If you've ever wondered how to keep yourself and your kids happy and healthy and strong for life, then this is the episode for you. Welcome to Move Better with the Cheer PT, where I'll be teaching you how to embrace movement, fitness, and a healthy lifestyle so you can keep up with your kids, reduce injuries, and have fun in all aspects of your life. I'm Laura Turner, a doctor of physical therapy, a certified functional strength coach, and a former cheerleader and coach. Thank you for listening. Now let's get on with the show.
Hey, welcome back to Move Better with the Cheer PT. Today I have with me Beverly Mazza from Westborough, Massachusetts, and we're going to be talking about health coaching and some stress management, how she incorporates health coaching into her nursing practice and different programs along the way. I hope you enjoy it. If you like this, don't forget to share out with other people so that they learn the information as well. And if you would click the link, leave a review, let me know how we're doing. If there's anything else that you'd like to talk about in the future, please let me know. Let's get on with the show. Here comes the conversation with myself and Beverly Mazza. Hi, it's nice to meet you, Bev. Tell me about yourself. Why did Cheryl want to introduce us, I guess?
So I'm Bev. I'm an internal medicine nurse, and I also have my own business, Purely Present Health. So I really focus on helping people build healthier habits, especially around our really busy, stressed out lives. So really saw a need working in a doctor's office that people were really needing that support outside of the home. So I did get further education and training as a certified whole health educator, which is really kind of looking at the body more holistically, and then also in health coaching and patient advocacy.
So in looking at your website, you work at a local hospital. You also work at for me, it would be considered outpatient, but a doctor's office.
Yeah, so I'm actually no longer in the hospital. I left the hospital probably over 4 years ago. I was doing like a cardiac neural floor, but I'm working in a concierge internal medicine practice in Wayland, and love my work there, but still felt like there was more I could do and offer to really help people outside of the home. So when thinking about what could I do, that's when I decided to set up my own private practice where I could really work with people one-on-one, really work through their health issues from a holistic standpoint. So I really focus on like 4 foundational areas of health in my programs, which is really working with people around intentional movement, how they're eating, how they're sleeping, and stress management. And my focus with stress management is really mindfulness approaches to changing our habits, which is so really difficult for people, and also an area where I always found people were kind of getting really down on themselves and feeling really defeated and really self-deprecating. And so that's where I really love infusing my background in mindfulness training, because it brings in a lot of that self-compassion piece, understanding, and that kind of moment-to-moment awareness of what we're doing, which can be really, really helpful and really, really impactful across all of those areas, when it comes to what we're eating and how we're moving our body and, how we're sleeping. So those are really kind of my focused areas that we don't always, pay as much attention to, but I think if we can kind of get those in order for people and create a foundation, it's only going to support them, in their wellness, but also if they are, struggling with particular like chronic disease or condition as well.
Yeah, I think so. When I hear mindfulness, my mind automatically goes to like meditation and whatnot, which I've started doing, and I'm kind of playing with how I'm doing it. But I think I like how you define that, and like being mindful just in our thoughts in general, and how we talk to ourselves,
Mhm.
and how we maybe process how we're talking to others also, and managing stress and all that stuff. Like everything on your website spoke to me as I was, I'm like, yeah, this is, so for me, I started Move Better in 2016 because I wanted to be able to reach more people. And I practice a little bit differently than I had been practicing, and doing different muscle testing and more gait and whole body approach, which sometimes the insurance-based world doesn't like you to, look, if you have a shoulder pain and you have hip pain, like, how is that connected? And they're just like, just treat the shoulder. Don't worry about the rest of it. And that drives me nuts. And so even in my practice at Rebound, I try to incorporate all of that. And I just have to be more mindful on how I'm documenting and specifying that. But, I think looking at the whole body and including more nutrition and sleep and rest and recovery and how we're talking to ourselves is something that I'm striving to incorporate into all aspects of where I do physical therapy or personal training also. And so I think that's amazing that that you've created the programs that you have to be able to teach people that, because, I went to the doctors yesterday and great appointment, and, they actually were very good. They tell me my blood pressure, but they didn't tell me my heart rate. They didn't tell, they like kind of like give you drips and drabs. And you have to be mindful and you have to be present and you have to ask that. And like, you're there for an hour, once a year, if you're healthy. And then what do you do the rest of the time, and how are you moving and how are you doing that? So I like that you've taken that, that you have this program basically. So how does that, what does your practice in Westboro look like?
Yeah. So first, I love that you just, backing up to what you'd said about sort of what, appointment can be, and then what do you do in that other time. And even in practices where you might even meet with someone every 3 months or every 6 months, or for many people, it's just a year. And it's like, what to do. Your doctor might say, oh, maybe try to lose some weight. You should have an exercise program and eat well. And then a lot of times it kind of stops there. And even with good intentions, you could go home and be like, okay, I'm going to eat well and I'm going to exercise. But what does that really mean? And I find that that's where people really struggle. And I feel like the role of a health coach, which is a little bit different than even my work than as a nurse, is to really kind of like get into your world and your life and be like, well, how are you really going to do this in a sustainable way? Yes, maybe you'll go on a quick diet and cut out all these foods and restrict calories or whatever, and you'll see a short-term result. But like, do you want to keep living that way? And what I've found in practice as a nurse is the answer is a big no, because it feels like you're depriving yourself. Even if you have a short win, you might then gain the weight back. And that's just my real goal, is to really work with people within their life, is, crazy, stressed and busy as it is. And it's like, what healthy habit can you do even on your worst day? And like, that's what we want to build upon. That's where we're really going to see that sustainable change. So that's really where I come from with this, and what I just love talking to people about. And it really is getting down to that nitty gritty, like literally, you know what I mean? It's not just, I'm going to eat well. It's like, well, what are we going to eat? When are we going to eat? How are we going to shop for this? All of those little things are so important. So what I really decided to do with my business, and I initially thought, oh, I would have like a brick and mortar and I'd have an office, and I live here in Westboro. And like COVID kind of showed us that that doesn't necessarily have to be. So it was a pretty easy decision and transition to say, I can do this all through telehealth. And I'm able to work with anyone in Massachusetts with one-on-one, because that's where my nursing license is. And even though I'm working with you in a capacity of health coaching, I still have my nursing knowledge. Like, I still am taking a full medical intake. I can understand your medications and everything like that. So I'm staying within, my licensure as a nurse. But even so, it's a big state of people that would need help. So it's really been great to have that option to do everything through telehealth, using, a secure platform, as many physicians are doing, that's HIPAA compliant, to be able to, house all that information. And then for me, kind of be able to deliver the programs and my materials in a way that's easy, because we don't want to add more stress to someone who's already busy. Right. So that was really one of my big things was, well, how are we going to make this so it's not like 100 emails back and forth and losing materials and stuff. So I kind of decided on like a platform that would house everything. So it's kind of like, housing that educational content. And then with that, you also have kind of these one-to-one, video calls with me as well. So to kind of support you all around, so you're not left hanging.
Yeah, that's good. That's awesome. So what, I guess 2 questions. What does your educational material look like? I don't know that that's the right question to ask, but like, what do you kind of stuff do you include in that? And then what does a one-on-one session look like also, like what kind of things do you talk about? And I mean, I know you said like how you're going to shop and that kind of stuff, but
Yeah, so within the programs, everything's divided into different modules. So as I said, kind of focusing on, I like to kind of after the medical intake, do a real focus on like a body deep dive, which I call looking at health through like the 5 aspects of health, which is part of my certification program that I did being a certified whole health educator, which is kind of looking at the physical, the emotional, the nutritional, the environmental, and the spiritual aspects of our health and looking at the body in that way. And then really helping people look at their health, whether or not they're quote unquote healthy, or if they are struggling with a medical condition, and like, how does it all tie together? And then how can we understand how, if we might have this condition, say we have hypertension, how are these other factors? How is our emotions playing into this? How is our diet playing into this? Our feeling of, how we are in this world and how we're interacting with people, and how those are really gonna help us change these behaviors once we start looking at the body from this whole approach. It's like you said, not just being at the doctor's and being told what your blood pressure is, right? It's like learning those other numbers and then what does that really mean, and things like that. So I always like to start with that and that understanding. And so with those, I might do some, exercises for people to do as far as like writing exercises, or even just something that they can think out and then share with me at our next meeting. So there's sort of some of these forms and worksheets that might support the work around that. And then the additional content I go through again is with, nutrition and movement, and stress management. So I do have kind of an intro to mindfulness component of this. So even though we're talking about, I feel like mindfulness for everyday life, which is like as you had pointed out, is also just how we're doing everything. It's not necessarily our time sitting on a meditation cushion, which I do feel like a lot of people can benefit from that support, because I find most people just feel like they can't meditate because they say, well, my mind's rushing around and that means I'm not successful in meditating. So I actually had opportunity to teach an intro to mindfulness course within the primary care practice I was in, which was a really great experience, just to kind of show people that it's not about shutting off the mind and being euphoric and having this like thoughts, that part of that practice is just noticing the wandering and coming back, and that connection is going to be strengthened. So I love supporting people around that and kind of debunking a lot of the myths of meditation, but then also helping them realize that that mindfulness can carry through their day. And so many, as you said, the interactions with other people, the conversations that they're having in their own head, as you said, which can be the harshest of all than anything else we're having, especially when we're trying to change something. That's when we really can be so hard on ourselves. So I really just try to build out the nutrition content, the exercise, not in a way where I always say, and I'm very clear to people, is like, I'm not a dietitian, so I'm not here to put you on a meal plan. Same with the exercise component. I'm not a certified personal trainer, so I'm not going to give you a workout to do. It's just really about exploring what's going to work for you. So yes, I can provide like the education piece. I'm always happy to refer out to a dietitian or a personal trainer or someone who wants to work on those things. That's why I like to kind of create a network of other like-minded individuals like yourself. I think that's really important to be able to, refer someone out with trust. But it's really just looking at it from more than one angle, which is, like necessarily, what am I going to eat today? And yes, I can help you sort of build out a healthier kitchen, but it's a lot of like learning about our own, like our thoughts and feelings around food. I do talk a lot about mindful eating, because I think that can be really helpful and supportive to people when they're first trying to make these changes and getting out of sort of that crash dieting mentality and just trying to find a way to eat that's sustainable and not feeling like they're deprived all the time. Because as I always say, like, I'm in this for the long run with people. So if like you're looking to lose 20 pounds in 30 days, like, I'm not your person. But if you're looking to kind of like establish habits and practices that are going to support you in the long term, that's what I'm really passionate about helping people with.
Yeah. And I think that that's huge, like, because I think but a lot of times we have goals to lose weight quick, or, I want to be able to train for a 5K, whatever that might be. But like, okay, then what, and what's your long-term health and wellness plan? you know, there's a lot of, I don't want to call them fad diets. I think they've been around for a long time or whatever that people will follow and whatever, but you know, does it allow you flexibility if you go on vacation? Does it allow you, you know, and I'm not talking like specific allergies and like people that need to be on specific diets, but just in general, like the average person who, you know, does it allow you to live your life? That's something that I've been learning a little bit more of lately in my own coach. And, you know, yes, eating the right foods for me and getting the right amount of nutrients in and all that stuff, making sure that's all on track, but also realizing that life is life. And sometimes you're going to go off track. And sometimes that's important for stress management, you know, but then recovering from that and getting back on it to, again, keep your stress on it, you know, because the foods that you eat is going to play, and the activity that you do is going to play into how you manage your stress in everyday life. So
yeah, no, I think what you said is really important. And I feel like that's when I was kind of, my wheels were turning and I was like, well, how do I really want to help people? Or where do I feel like people are, what do I hear from my patients the most? And it's like you said, it was, you know, stress. So it was like, you know, Bev, I was going to try to start eating better, but I'm so stressed right now. So I just don't have the time to focus on it. Or work's really crazy, so I can't exercise. And, you know, I'm up late nights because I'm working, so I'm not sleeping well. And so I'm hearing this, okay, stress, stress, stress. So that's where I was like, okay, like, well, how I have found completely life transformational for me was my mindfulness practice and helping me manage my own stress and kind of transform how I even thought about stress and how I even kind of cope with difficult situations. So with that, that was sort of why I kind of made that the core of what I was doing, because I want people to be able to do these habits and support themselves when they are the most stressed, because we tend to then kind of be like, oh, I'm stressed, so therefore I'm not going to eat well and I'm not going to exercise and I'm not sleeping well, and not prioritize it in the sense where I say when you are really stressed is precisely the time that you need to pay particular attention to how you're nourishing your body. Are you getting in movement? Because things are only going to snowball from there. If we think I'm so stressed, so therefore I'm going to put a pause, you know, and give myself a pass. It's harder to crawl out of the stressful situation or whatever is going on than if you have like a stronger foundation when you're like, this is really stressful. I'm struggling. This is really difficult for me, but I can support my body with, you know, this healthy meal, with, you know, my stress management toolkit, as I like to say, which maybe for someone is meditation, maybe it's calling a friend, maybe it's listening to music, but something to support you instead of kind of just throwing everything aside and being like, I'm just so stressed right now, I'm not going to deal with anything.
right.
So that's what I really like to try to like change the thinking that people have around that. Because I heard it over and over again. I'm so stressed. And then, as I always say, that it's like we always have stress, and that's just modern life. And yes, there's ebbs and flows of really like acute things that happen in our life, and you know that's going to be. But there's always an underlying aspect of stress with our modern day living.
Yeah.
And yet we still like to kind of say when I'm less stressed. And I'm like, well, when's that going to be?
Yeah, exactly.
It's hard. And maybe it's like a harsh reality of our modern day living, and we all respond and react to stress in different ways. So as I say, I don't, you know, I'm not a person walking around like I'm never bothered by anything or nothing stresses me out. Like that's not the goal I want people to have. That's not how I am, but I have been able to change my relationship with stress. And I feel like get less overwhelmed, or when you're like, okay, this is really stressful. This is really difficult. What do I know I can do that's going to support me right now? And I think that's really a game changer for people.
Yeah. Because you're right. Not like there's always going to be those ebbs and flows of, I mean, life is stressful just living, you know, but those ebbs and flows of, you know, for me, my father was in the hospital this last year and like went through a lot of changes, and like he's okay now, but that whole time was, you know, a roller coaster of how am I managing that, and how do I, you know, and that's just part of life that, you know, sometimes there will be some illness, or there will be, you know, your own illness, or there will be, you know, the hurricane, that just came through, and, there's things that we can't control, but if you can control how you react to it and how you manage it. And like, sometimes for me lately, I've been getting into, okay, I'm stressed, I need to start to breathe.
Mhm.
And that's been what I'm trying to go to, but, get in the car and yell maybe, or like how, but I try not to, and maybe you will have a mac and cheese because it feels good, but like, okay, maybe that's the one meal, and then get back onto your healthier eating, or, take a walk, or finding other ways to be able to manage without letting it just snowball. And, and then 6 months have gone by and you're just in a hole.
Right. Yeah.
Yeah.
No, I think
Yeah.
that snowball analogy is really spot on. Definitely what I've seen sort of in clinical practice with nursing. And there's just like that lot of waiting for that to pass before you start really paying attention to your health and caring. And when you say it like that, it seems really obvious. It's like, well, why would I do that to myself?
Right.
But, when we're in these situations, that's all we kind of see, because we keep thinking, down the road, all of us, like I always say to people, I was like, is there ever a time that's just going to be perfect and calm? And you're like, I'm
Right.
going to transform my life. And that's
Mhm.
not really how it works. But what can work is with the small little things that you can do. Breathing practices, I think, are really a wonderful practice for anyone to do, but especially sort of that entry level, especially if people are like, I don't know if I can sit on a meditation cushion.
Right.
But breathing is so available to us at all times, and it's so powerful, and it taps into what we're wanting to do, which is sort of that parasympathetic, which is sort of our relaxation response, when many of us are on the other side of the coin, which is that sympathetic response, which is our fight or flight, and we're running around in that all the time. So when you're doing those breathing practices and you're taking that time to mindfully pay attention and slow the breath, you're telling your body that you're safe. Because if there's really chaos and danger around you, you're going to be breathing rapidly and shallow. So you're kind of like tricking your brain, in a sense, to be like, you're safe, so that can really help bring you to a calmer state. And you can do it anywhere. And even just like a minute of breathing can be
Right.
really impactful for people. So I love always offering that to people to start with. I think it's wonderful.
Yeah. My brain says, okay, nursing, are you doing, and in a, actually, I'm gonna ask this first, because this is a question that I get from, really from my parents more so than anything, but, what's, as a nurse practitioner, how is that different than, not in an education, not in like, just how do you practice different than like someone that's not a nurse, I don't want to say just a nurse, because I think nurses are amazing,
I actually am an RN. So
okay.
Yep.
Okay.
So I'm not a nurse practitioner.
Okay.
So I am, I have my bachelor's in nursing. Yeah. So, so I'm not quite sure then what the difference would be in practice per se, because, I'm not a nurse practitioner.
So how do you, like, so in purely present, how are you, it's more health coaching than necessarily nursing. Like, you're not taking blood from people unless they're coming to you at a clinic, like, or do you recommend, that's where I was leading with this, is like, how does blood work lead into your, how you're working with people when you work on them? Is that part of the process? Like, do you do that in your own
like as far
practice,
as
in your own,
stuff like so so not right, because I'm an RN and not the nurse practitioner, so I can't diagnose, treat, prescribe, but I can look at a medical history, obviously, and have my nursing eye on what I'm looking at, understanding what all the health conditions are, understanding what the medications are, understanding kind of that connection of the vital signs, if I'm looking at someone's blood pressure, to be able to interpret that. And knowing what's kind of normal for lab work as well. So that's all within me kind of understanding. But with that would be a collaboration with another provider. So whether it's, a medical doctor, a naturopath, a nurse practitioner, somebody who is licensed and authorized to then order testing. So I don't have the ability to order any tests. Can certainly, again, refer out to different practitioners that might say, hey, like, this is something you might want to speak to your doctor about. This might be worth looking into. But I like to just like have that nursing eye on looking at everything sort of collectively, that I know that like I can look at a medical history, I can understand what medications you're on, I can like look at your blood pressure. So all those are with my understanding of being a nurse, that I can kind of bring those connections together. And I think that's really helpful, especially when people present with kind of like multiple different medical conditions. So whether they have like a pre-diabetes and a hypertension, maybe they have a component of like fatty liver disease and things like that, I can understand kind of more like holistically, okay, like how does this all go together? Because sometimes, people don't really understand that each of these body parts are actually connected. So that's something I definitely like to chat with people about. Instead of thinking these are kind of like all incidental, that even though we have a healthcare system that is of all different wonderful specialties and brilliant minds in all these different body parts, that it is important, I think, as a patient to kind of understand, well, how do these all things tie together? How does this one condition connect with this? And then if I do something in this one area, how's that going to benefit another? So that's really, I feel like the nursing practice comes in and can help me and help me help the client understand what's really going on with their health.
So you take a history from people, or you get their history, and that's where the one-on-one conversation comes in. And if you're doing it online, like you have them somehow check their blood pressure or get where their blood pressure is. And that's how you're doing your assessment. And then taking that.
Yeah, absolutely. Whether they're coming from, working with their physician, looking at, if they have a home blood pressure monitor at home, looking at those numbers. And then, part of the intake process, obviously, is getting people's permission if they'd like me to collaborate with their physician or their other healthcare provider to be able to share information with, is always, I think, helpful to help people with their efforts. Yeah. So the thing I like about sort of the initial like intake is obviously, the general, like, medical history stuff, but it's also asking some of those more poignant questions into bringing a little bit more of a holistic view into it. When you are sort of asking them about, your eating habits, your sleep habits, how you're moving your body. And then also like what challenges are you facing in doing these things? If you're not doing them how you like, if you're not eating the way that you like, well, like what is it that you're struggling with specifically? And that is what is not part of a traditional medical intake,
Yeah. 100%. And it's definitely, it's a frustrating area from where I am right now, and as a physical therapy standpoint, like, and being able to tie it all together. And sometimes, like I said, like even just on a movement base at, how things are connected, but like your internal organs are going to affect how you move also. And what you're on for medication is going to affect how you move, and taking that. And I'm, we have a medication and a background. We don't prescribe medication, and I can't, but I need to know what medications, how that will affect. But quite honestly, like I get a list of them and I get an idea. Okay, that more of it gives me an idea for what their history is, because sometimes people don't, they're like, oh, I'm on this medication, but like, no, I have no medical history. I'm like, well, you do, but and so helping that to tie it together. And I think I get frustrated because a lot of times I think everybody kind of gets just focused on, okay, I've got this one medical condition and that's it. And like, but tying the pieces together and how do they all fit together? Like, I think there needs to be and I guess this is where primary cares, or what I expect primary cares, or, and are going to put together, is putting those pieces together from your gastroenterologist and your urologist and your, and putting like, okay, how do these all blend? And I haven't always seeing that they're like, oh, well, I can't handle, that. You have to talk to that person about that. You have to, like, they corral it, they keep it together, but they're not actually teaching you how to manage all those pieces together. And it is so. I think it's really important to have somebody that can do that, because to just pull all those pieces together. So I'm glad you do that, I guess, is my rant there. But
yeah, no, I agree. I think it's really important. I think it's an area that doesn't kind of get enough focus and attention. And I think it's kind of a missing piece that can really help people and also like empower you, as the patient. That yes, there's so much out of our control when it does come to our health, but there's so much that is in our control of what we can do to whether or not to prevent illness, or even when we do have an illness or a chronic condition, there's always something that you can do to support your body. And it's discovering like, what can that be that's sustainable for you and feels good for you and feels right, and that you're going to continue with doing. So part of it is that education piece. And then part of it, I think, is definitely, at least when you're getting started, is sort of that accountability of knowing that there's somebody who does care about you and who's there to answer those questions for you, and that there's no stupid questions, and we don't expect you to have known, what you don't know. And a lot of times, so much what I find with people, it's like, they say that the whole saying of like, you don't know what you don't know, right? Like nobody said this to you, or you never made this connection. But once you do know it and you can kind of step into that understanding and that power, I think that people can really have some positive outcomes that they wouldn't necessarily have had if they hadn't kind of taken a chance and kind of opening up their understanding, of what is really possible for them to be able to help themselves feel better.
Yeah.
Yeah.
So education is a huge piece in that. And, I, as a movement specialist, the same, like, I think more of what I do specific in both practices, but I spend more time in my own, at Move Better, educating. We have a lot more conversation about, how can you incorporate this into your everyday life, and on a day-to-day basis. So, who do you work with? Like what kind of people, and do you have a population, I guess, is a niche, is the business term we use.
It's always like a great question, because I feel like as a nurse right now, I'm working with, adults, right? Anyone from, 18 up through geriatrics. But really my focus for my work in my business has really sort of been around middle age, those years when I like to say, like, you're 40 to 60, like these, just see like a lot of changes with people, like a lot of maybe like their kids are getting older. I think 40s just seems to be like this magical or not magical time where all of a sudden like a lot catches up with people. And so I feel like in practice and nursing, definitely it started to see with people all starting to gain weight, the lab work showing, you're pre-diabetic, or maybe you've even moved into type 2 diabetes, the hypertension, seeing all those things sort of creep up and seeing like, okay, how do we start to kind of capture people to start, making changes in their health before, you're further down the road. And it's really more of set in of a chronic illness where, not that you can't always support your health if that's the case, but I would love to help work with people to sort of prevent that kind of insidious onset that we see over, decades of kind of unmanaged, health concerns that we might have and unhealthy habits.
And that was my question.
Yeah, no, it's good. So I definitely, I don't, I always say like, I'm open to working with anybody who's looking to change their health habits. Absolutely. But I would say, not pediatrics, definitely, adults. So that being, with that focus. However, I do have a lot of like, older patients as well that I work with, as a nurse, who are just as interested in doing this. So it's not an exclusion of, I have to be, quote unquote, in my 40s with this new diagnosis, but just something sort of I was seeing in practice and being that's of my generation, of my age, that I feel, very passionate about working with that group.
I internally cringed because I remember, this is going to be a long story. So I remember turning 40, and 40 to me was like, I never had a real issue. Like I was excited about my next birthday, whatever. And then 40 hit and I was like, oh my gosh, like it just was a huge, where am I? What am I doing? What is, where am I going in life? And that to me was like, that always felt like a big step off turning point to me. And this year I turned 55 and now I'm like, you just talked about, that 40 to 60 range, which I'm still in, but I'm now closer to 60, which blows my mind. But I don't feel any different. I do feel different than I did at 25. I don't feel any different than I did at 40. I think I'm pushing myself differently than I was 25 years ago. And I don't see that change. I see that just continuing to get better. And I guess my thought is, why can't I do the same thing at 65, at 75 that I'm doing now? And I do see things changing, but I hope to teach people that they can continue to do what they want. And I think on a whole, our society is getting, I think in general, our activity levels change. People, when I was 20, I thought people at 40 were old, and like they're slowing down and they're not doing as much as they used to. And yes, but I still like to go and do, I like to hike. I haven't been skiing in a while, but I still want to ski and I hope to do that long term. And so I think more people have been pushing the limit and they're doing more at an older age. My uncle just turned 90 and he still climbs trees, and it's crazy. Wow. And so I guess I cringe because I'm like, okay, things are changing, but can we keep healthy? Like my goal is to, like, I'm not on any medications, and that's my goal. Like if I can get through long term to not have to be on blood pressure medication or diabetic medication or cholesterol meds or anything, if I can stay in that, that's my health goal, is to be able to do that. And that's what I hope to give people also. And knowing that I have some things I need to dial in on my nutrition and some mobility stuff, preach mobility, but like my own mobility I know is changing and lacking. But I think what you're doing can help people to recognize that, I guess, is where I'm saying that. And, and that's my goal too, is to try and, yes, life changes after 40 and things are different. And I don't have kids, but, your kids are getting older, you've had kids, whatever. And that whole lifestyle is changing. And how can you stay active so that you stay healthy and keep doing this? I think the 20 and 30-year-olds are going to be living longer. And so what does that look like? And I think all of us, I think our generation is pushing to be able to stay more active longer term. And that's creating a better trickle down effect. Hopefully, that it doesn't mean that you have to be stuck in your house and not doing anything and just, clicking the TV and being sick all the doors, whatever that, not even just sick, but like being able to stay active and do that. And so I think that's, I don't know where I was going with that, but
I think it's challenging sort of our mentality of aging, as you said, of sort of, everyone says, oh, well, as you age, you just develop these chronic conditions and then you take these medications and then you lose your mobility and then you can't exercise and then that's it. And I think it is kind of challenging that, and it is capturing people at a younger age, not once a lot of these issues have set in. But as you said, like 20, 30, okay, you might not be really thinking about these things for everyone, but there does usually get to a tipping point with people where something might come up with their health. And then it's like, well, what are we going to do about it now? Right. We know what the result's going to be if we don't do anything about it, because we have plenty of examples of, of how that can go. So, I think what you said is like a really good point. It's like, what can we do now, knowing what future we want to have and what we want to be able to continue to do and like the lifestyle we want to continue to have as we age. And as the work that you're doing and the mobility piece and things like that, I mean, that is so important, because it is one of those things I feel like that's one of the first things that people stop doing. They stop with the movement and they stop with exercising, and leads only to chronic pain. And then that usually kind of can be the real tipping point of lack of exercise. Then that leads to weight gain, and it's just can be a really vicious cycle that I see playing out all the time. So I think doing the work that you do, I mean, I think that's really important for people to realize how important that movement piece is, to be supportive of overall health and kind of the quality of life you want moving forward as you age, and kind of keeping up with that.
Yeah. Yeah, I think so. Part of my, I have a little bit of two different people that I aim to work with. I have a background in cheerleading. I cheerleaded through college, and I coached until 2012, I think. And so I'm very passionate about, giving back, and continue, like cheer has been a part of my life for forever. So I am passionate about creating injury prevention programs for cheerleaders and helping them to stay injury free. But they're not wanting to, they don't think they're going to get injured, or they don't, you brush an injury away. I sprained my ankle, no big deal. I can still get out and tumble and fly. And they can, but there's things that they need, that could come back to, I don't like the word haunt you in, 20 years. That ankle sprain, potentially may change how you walk and may develop into some hip pain. They're not wanting, and I didn't want to hear it when I was, cheerleading either. But so that's one aspect. But then I also, the 45 to 65 and older, maybe, and how did those injuries affect your back now? And like, it's not necessarily a direct correlation, but yeah, you have this old injury, so maybe it still needs some, like I had an ACL injury, and sometimes my scar still needs some love, or it doesn't stop me from doing anything, but sometimes you need to pay attention to that. Just keep it there in the back of your mind, but don't let it limit you. And the other thing, I hear people a lot come into the clinic and say, I can't do that because, I've got a bad back. Well, okay, well, let's make that move better so that you can do that. Or how can we modify what you're doing, nudge that motion forward so that you can continue to do what you want to do. And like that old injury doesn't have to stop you from doing things, but maybe you have to, work a different movement in there, or like what does feel good, find out what feels good and do more of that. So that's trying to include all of that into move better and rebound and everything, just in my general practice in general. No, sometimes I need my own reminders on that too.
Yeah, I know. I love how that ties into, I feel like my whole approach as a health coach is, as you said, is, a lot of times people set these limitations on themselves of like, I have pain here, or I've had this injury here, and then don't really explore other ways that, well, how can you move, or how can we do this safely, or what can we do as an alternative? And I think, having the opportunity to work with a physical therapist such as yourself that can offer that is, again, it goes back to stopping the like black and white thinking, or the all or nothing thinking of, I'm defined by this one injury or something, or like, I can't do that. But it's like, well, let's explore all the things you can do. Instead of just kind of stopping at that. Like, you're right, you might not be able to do that one thing, but maybe there's all these other things that you are, capable of doing. And we can, it's kind of getting into the world, understanding what's going to work for them and working with them to find something, instead of just, deciding that they're not capable of doing it at all.
Yeah. Yeah. So how can people work with you, and how can they talk with you more, or learn more about you, or connect with you?
Yeah. So I do have a website. So it's www.purelypresenthealth.com. So on there, you can learn a little bit about me and the programs. I do offer like complimentary consultation calls. So 30-minute calls. So you can book that right from my website. No obligation to do a program or anything, but can kind of just touch base and just have a conversation about, where you're struggling, where you're hoping to go with your health. I'm also on social media. I'm on Instagram at Purely Present Health, and have a Facebook business page as well. So everything pretty easy to remember. It's Purely Present Health across the board if you search for me. But always happy to engage in any conversation. over email, over, private message or anything, or just getting face-to-face on a call as well. Again, just to have a conversation. Been happy,
Awesome.
always be happy to do that.
I'll put all those links down in the show notes for this too. So it's easier nobody has to remember them offhand. But
yeah, love that. I'd love to have anybody who wants to, get more support around this is just joining my mailing list as well. You can do that. Again, just signing up. I do have a free guide right now that's 5 ways to meet stress mindfully. So with the sign up to the email list, you get that download and talks about, what is stress? How is it impacting our body? And talks about 5 things you might be doing right now to manage your stress that is actually not so good, and gives you 5 things that you might want to think about starting to do to help manage your stress better. And then that gets you on the mailing list, which, I send things out periodically, try to do some informational series as well, and then would be able to learn about I do some like free talks, wellness talks and things like that, and get you on the list. So you'd be the first to know about that.
Awesome. Very cool. So I'm going to stop recording and we'll.
Sure. Thanks for joining us, everyone. We hope you have a great day. Don't forget, when in doubt, breathe it out. Take life one step at a time and get after it today. Thanks for listening to this episode of Move Better with the Cheer PT. If you enjoyed the episode, please share it so more people can learn how to embrace healthy and fun movement. If you'd like to work with me on your fitness journey to stay strong and healthy, you can find me at the link listed below. That's where you'll find all my free guides and access to all my social media channels, as well as to book an appointment for a free discovery call to discuss your goals. Thanks for being part of our cheer team. Remember to live life without deductions and with extraordinary cheer.